Really?
Okay.
Alrighty. So, what first brought you to our office, Joan?
Okay. I got what I call the Christmas present one Christmas Eve morning when I got up and I had a great big piece of cement underneath my left shoulder blade, and it made it difficult for me to breathe, and it scared me because I'd never had that before.
Sure.
And I couldn't do anything to relieve that, and so my husband and I started calling chiropractors thinking that that's what I needed. However, I was resistant to that because other chiropractors that I've seen, or anytime I've had that, I couldn't relax for them and I didn't feel I benefited. And it was because I would have this fear that they were going to break me.
Sure.
And what really then was very different for me, but when I told you and that I didn't like chiropractors because I didn't want them to break me.
Right, right.
And you said, well, I think you'll find that I don't do that.
Right.
And that was exactly what I needed, and so that's what brought me and kept me coming back. The initial thing that changed about me is that I became aware that I really was a tense person when I had fooled myself thinking that I can chill and things don't bother me and I don't get uptight and I'm not tense. And that awareness was monumental for me because that really started to change my whole outlook. And it had an effect on some decisions that I would make. For example, I was thinking about retiring because I didn't think that it bothered me as much, that I was ready. And once I have this sensitivity to my tension, I would be in an area and all of a sudden I could almost feel myself getting tense. And I thought, oh, there's a message. Maybe it is time. So that was the initial thing. And then after I started to adjust to that, I had more time on my hands, of course, and I needed to lose weight. And I didn't like diets. And so because of this awareness, and I knew I didn't go on a diet, but I started to control my eating and stopped eating when my hunger was satisfied and made myself patient to not expect it to make a change dramatically. And I didn't want it to make it dramatically because I wanted this to be gradual and then stay off.
Sustainable.
Yes, and I lost about 45 pounds. The main thing is that I don't think I'm unusual in that my personality is, I care about other people, but because I care about other people, I would start to take their problems onto me. And then I was naive enough to think, well, that's what I have to do if I really care. I have to. And yet over the time period, which has been, what, about 2 years now, I have learned that no matter how much I embrace somebody else's problems, it doesn't make any difference for them. But it does make a difference with me because then I start to have their same problems.
Exactly.
And I never have really been a worrier, but I realize that I am a worrier. So because of my relationships with others have changed, because my relationship with myself has changed.